Okay, good morning, everyone. For those of you who are returning to our workshop series, welcome back. And for those of you attending for your first session today, thank you for joining us. In this morning's lesson, we're going to talk about the importance of properly cooling food. We do have a number of attendees today, so if you have questions throughout today's lesson, just go ahead and put your questions in the chat. We're going to try to address questions at the breaks and at the conclusion of the presentation as well. So my name is Chelsea. I use she, her pronouns. I'm the inspection program lead with Washington State Department of Health Food Safety team, and I've been here for just over a year. Prior to that, I worked for Whitman County Public Health for 7 years as an environmental health specialist.
Chelsea, you just went on mute. There you go.
Okay. I don't know how long I was muted for, but my name is Chelsea, and I am going to be your presenter today. I'm coming to you from Clarkston, Washington. That's in Asotin County in the southeast corner of the state. So today we'll be talking about the importance of properly cooling food. We're going to discuss the public health significance of cooling. So why do we care? Here we'll look at the burden of foodborne disease, the cooling pathogens of concern, and some of the illnesses and outbreaks associated with improperly cooling food. We'll then review cooling methods and how to cool food safely and following procedures approved in Washington State. And finally, we'll learn how to evaluate cooling practices. So since we have a variety of attendees today, we'll cover both what inspectors should look for to evaluate cooling, as well as what verification and monitoring efforts operators can use to implement and ensure cooling practices are performed correctly in their establishment. So the average person gets their food from a grocery store or from restaurants. Not many people think about all the processes and steps the food has gone through before it reaches our plate or our refrigerator. In this room, we're food safety or food service professionals, so we typically have a more holistic view about food processes. And while it's relatively easy to train on proper methods we can use, training is much more impactful if we understand the why. So why is food safety important? Why is cooling important? Why are our standards or our policies important? So to answer this, let's talk about the public health significance of cooling. Ultimately, the public health significance of food safety is to prevent foodborne disease. And foodborne illness is the result of ingesting contaminated food. So foods can be contaminated by microorganisms, or bacteria, viruses, parasites, as well as chemicals and toxins from the environment. Many pathogens are naturally occurring in food products, and pathogens can also be transferred from people to food or from food to food through cross-contamination. But by following proper food safety practices, most of those pathogens can be controlled, preventing people from getting sick. So the key is to understand that foodborne disease is preventable through a strong food safety management system. Foodborne disease can have a huge impact on a community. The CDC estimates $15.6 billion in related costs, and those financial impacts may include individuals experiencing illness, healthcare costs, as well as local, state, or federal health departments that are investigating illness. And sometimes foodborne illness can lead to financial hardships on food establishments or food processors if they might be implicated in an outbreak or recall. There are approximately 48 million foodborne illnesses in the US each year. That's about 1 in 7 people. And 960,000 of those are in Washington State. So that's about 1 in 8 people. 128,000 in the US are hospitalized each year from foodborne illness, and over 2,500 of those are in Washington State. And unfortunately, there's approximately 3,000 deaths from foodborne illness in the US each year, and 60 of those are in our state. So we're going to look at a lot of numbers and data through this presentation, but consider each case as a person and each outbreak as a group of people. You know, some of you may be regulators who have investigated a foodborne outbreak. Some of you may be members of industry or an operator of a retail establishment. But each one of us is a consumer regardless of our profession, and this web of food safety really impacts all of us. So it's important to prevent foodborne disease whenever possible by keeping food safe to consume. So consider the numbers we just saw as the tip of the iceberg. What's reported is really only a small portion of the number of people who actually experience foodborne illness. So if you look at this iceberg, the bottom level represents the true number of ill patients, but generally only a percentage of patients will visit a physician, and even fewer will get diagnosed with a lab test. An even smaller amount of cases will get reported to local, state, or federal, the CDC. So we're going to review a lot of outbreaks and illnesses during this presentation that were reported and documented by the CDC or State Department of Health, but keep in mind what's reported may only be the tip of the iceberg, and it's likely an underestimate of the true burden of disease. Okay, so here are the 12 main pathogens causing foodborne illness. They're grouped into 3 categories. So we have our non-spore-forming bacteria, our spore-forming bacteria, and our viruses. This list does not include parasites, chemical, or other toxins that can cause foodborne illness. It's really just a simplified list to highlight the main pathogens that we're going to be focusing on today. So our non-spore formers, like our Salmonella, E. coli, Listeria, Shigella, these can all be killed by cooking. So when the pathogen is naturally maybe in the food, it can be cooked out if the food is cooked to proper temperatures. And similarly, our viruses, so our hepatitis A and our norovirus, those can also be killed by cooking. Our spore formers, however, cannot be killed by cooking, and they'll actually proliferate or multiply when they're temperature abused. So we're going to focus on the spore-forming bacteria today. Clostridium perfringens and Bacillus cereus are the main pathogens of concern with cooling. The other spore former listed, Clostridium botulinum, is not typically a pathogen associated with cooling. It's common in improperly canned foods, and it's the pathogen that causes botulism. So we're not going to touch on that a ton today. We're mainly going to focus on Bacillus cereus and Clostridium perfringens. So let's take a closer look at those now. While cooking meat and poultry products will destroy the vegetative cells of those non-spore-forming bacteria, like your Salmonella, E. coli, Listeria, the spore-forming bacteria like Clostridium perfringens and Bacillus cereus form spores. So they're like a protective coating that can survive cooking. These spores grow into vegetative cells during cooling because they don't have competition from the bacteria that have been cooked out. So they're kind of at a freedom point, right, to just kind of multiply on their own. They don't have any competition. So the best control to stabilize heat-treated products is to rapidly cool them to reduce the amount of time those spores have to grow. Okay, so let's take a look at both pathogens a little closer. So our Clostridium perfringens, or C. perfringens, is what's called a facultative anaerobe. This means it can survive in the presence of oxygen, but can also switch to fermentation if oxygen is absent. It can cause an infection with possible toxin formation in the digestive tract. So the incubation period is 8 to 12 hours. This essentially means the time between eating food contaminated with C. perfringens to when symptoms start. And when someone consumes the food contaminated with C. perfringens, these toxins form in the GI tract, and then the individual starts to experience lower GI symptoms such as watery diarrhea, nausea, abdominal cramping. Fever is rare, but it can happen. And then the duration of these symptoms is typically 24 to 48 hours for C. perfringens infection. So these bacteria multiply much faster than most other bacteria during temperature abuse because of the nature of the pathogen, as well as the lack of those competing organisms after cooking. So remember, the non-spore formers are killed by cooking, leaving the spore formers to proliferate and multiply without competition. Some common sources of C. perfringens include meat, poultry, gravies, and other foods that are typically cooked in large batches and then held at unsafe temperatures. So we see outbreaks that tend to happen in places that serve large groups. They're cooking product in bulk, right? Such as hospitals, school cafeterias, prisons, nursing homes, and events with catered food. And outbreaks also tend to occur in November and December and are commonly linked to foods served during the holidays. So your turkey, your roast beef, your gravy. And then for control measures for this pathogen, we have proper cooling and reheating to move food quickly through the danger zone, which we'll talk about a lot in our next section, and then to hold food at proper temperatures. Okay, so let's talk about the other spore former of concern with cooling, and this is Bacillus cereus. This pathogen is naturally found in soil or dust and produces two types of illnesses. There's the emetic or vomiting type illness and the diarrheal type illness. So for the emetic type, the incubation is 1 to 6 hours, but it can be as early as 30 minutes. So remember, that's the time between somebody's eaten the contaminated food with B. cereus and the time they start to show symptoms. So this can be relatively quick. The symptoms can include severe nausea and vomiting, and typically lasting for about 24 hours. And then for the diarrheal type, the incubation is a little bit longer, so it's 10 to 16 hours. Symptoms including abdominal cramps, watery diarrhea, and nausea, so your lower GI symptoms, and typically lasting 24 to 48 hours. So for Bacillus cereus, it actually might cause a lot more cases of foodborne illness than what is known or recorded. And one of the reasons it's underreported may be that people have fairly mild symptoms, it's pretty brief, and so they don't seek medical attention. B. cereus is transmitted by consuming foods that are often naturally contaminated and then subsequently temperature abused, allowing that incubation of the pathogen. The common foods associated with the vomiting type illness are your rice products, your starchy foods such as potatoes and pasta, and then a wide variety of foods including meats, stews, and gravies have been associated with the diarrheal type. So for processes to control the pathogen, again, we have our proper cooling and reheating and temperature control. So now let's take a look at some outbreak data focusing on these two pathogens. So here's a graph showing data from CDC's National Outbreak Reporting System, or NORS. This represents the total number of outbreaks of both Bacillus cereus and Clostridium perfringens per year from 2010 to 2020 in states that report to the CDC. So this is national data. And an outbreak in this respect is defined as 2 or more individuals who got sick from the same source. And then these data also represent both suspected outbreaks, meaning Bacillus cereus or C. perfringens was identified through epidemiological interviews, symptom analysis, and also our lab confirmed cases where the individual submits a sample and tests positive. So from 2010 to 2020, there was an average of 47 outbreaks per year of these two pathogens. And remember, that's at least 2 people involved, but the average number of ill people in a single outbreak during this time was 28. So about 28 people on average involved in each outbreak. The largest outbreak in this time frame was in 2018, where nearly 650 people got sick and 2 were hospitalized with C. perfringens after dining at a quick service chain in Ohio. So these can be small, 2 or more people, maybe they shared a meal together, but these can also be very large outbreaks as well. So using the same data from CDC NORS, this graph shows the total number of hospitalizations and deaths from outbreaks associated with our cooling spore formers nationwide. So again, that's B. cereus and C. perfringens. And typically the illnesses from these two pathogens are short-lived and they don't have very serious consequences, but you can see here that there are instances of hospitalizations and even deaths from these pathogens. And this is why we really care about proper cooling. So the most hospitalizations in a single outbreak during this time period was 4. And that was an outbreak in 2016. 84 people got sick and 4 were hospitalized after eating gravy at a restaurant in New York. And the most deaths in a single outbreak was 3. And in fact, there were 2 separate outbreaks that had 3 deaths. One was in 2010 in Louisiana, a C. perfringens outbreak at a state psychiatric hospital. 54 people got sick, 3 were hospitalized and subsequently died after eating chicken salad from the cafeteria. And then another one in California in 2016, there were 23 people that got sick and 3 who passed away after eating a holiday meal served at a church, which we'll highlight in just a few minutes. So this graph is showing national outbreaks by pathogen type. Remember, we had our 3 categories of pathogens a few slides ago. So we have our spore formers in blue, our non-spore formers in yellow, and viruses in gray. So typically viruses encompass the most foodborne illness outbreaks each year, and spore formers are a close second. And just to note for this graph, the spore formers do include our cooling pathogens, so our C. perfringens and Bacillus cereus, but also include Clostridium botulinum. So the previous graphs we reviewed didn't include Clostridium botulinum. It's typically not a pathogen that's caused by improper cooling. Remember, it's most common in improperly canned foods and causes botulism. It's much more serious in terms of symptoms, hospitalizations, and deaths because it affects the nervous system when ingested. Okay, so let's take a look at our local data in Washington State. So this graph highlights the outbreaks in Washington from 2010 to 2021, specifically looking at our spore-forming C. perfringens and Bacillus cereus. The dark blue bars are the total number of outbreaks related to these pathogens, and then the gray bars are outbreaks where cooling was identified as a contributing factor during the outbreak investigation. So as you can see, there are only a few outbreaks where cooling was not a culprit. In fact, in the outbreaks listed here, about 70% identified cooling as a contributing factor for the outbreak. You see a spike in 2016 that shows 8 outbreaks. And while these numbers look relatively small, remember that true burden of disease iceberg. So this is only what was reported to DOH, and we're also only looking at 2 pathogens. And remember too, this is number of outbreaks, which are anytime there are 2 or more people implicated, but one outbreak could involve many more people, right? So for example, in 2012, there was an outbreak that included 237 people that got sick after eating dal curry, where temperature abuse was identified as a contributing factor. Okay, so we're going to highlight a couple of outbreak instances now. So I mentioned earlier this holiday meal when we were looking at national data. So this was a church group in California. They served a holiday meal that killed 3 people and caused 24 illnesses. The meal was suspected to be contaminated with Clostridium perfringens. There were extensive interviews, and most of the individuals who got sick ate turkey and mashed potatoes around the same time. Some dishes that were served at the event, including the turkey, were brought into the site after they were prepared in private homes. And many of the 800 people who ate the church meal were elderly or residents of assisted living centers, including the 3 who passed away. So typically, again, you know, when people experience these illnesses, they're typically mild symptoms, but when you have immunocompromised folks or folks that are part of a highly susceptible population, they're more susceptible to the serious consequences, hospitalizations, and potential death. You also notice the age range of the folks who passed away during this outbreak, 43 to 69 years old. So it's not just elderly in this case, right? Anybody can really be seriously impacted. And a few factors that they identified that may have caused this outbreak was advanced bulk preparation in private homes, where people may not be equipped or skilled for preparing such large meals. And we can assume the bacteria flourish with improper cooling and food sitting out at room temperature for too long. Another example, a former chef of a pub in England has recently been given a 4-month suspended jail sentence in connection with an incident that killed 1 person and sickened more than 30, and that was in 2018. He was just recently sentenced. The pub was not licensed as a food establishment, and they identified poor cooking, cooling, and reheating practices of various ingredients that led to the shepherd's pie becoming contaminated with Clostridium perfringens. So many folks in this case called to report severe stomach cramps, diarrhea, and unfortunately a 90-year-old woman passed away from eating the shepherd's pie. And the former chef, he pleaded guilty to 3 charges of violating food safety regulations and admitted he was rushed. In this quote, he said, "I really hate to say it, but I think I was rushed. I was rushing. This is something I will never forget. Because of it, I'm a better chef, and it's just a shame the cost of it had to be what it was. So a simple mistake or a rushed process can have serious consequences. And so this is kind of why we talk about taking the time to understand the process and how to prevent illness like this from happening. Another unfortunate incident involving a 50-year-old from Charlotte, North Carolina, who ate a meatball sandwich with a friend in March of 2015 at a quick service chain. Doctors said because the individual had diabetes, he was a perfect host for Clostridium perfringens. He died of an intravascular hemolysis and liver abscess caused by Clostridium perfringens, which multiplied so quickly the doctor said he didn't have a chance. He went into intensive care just 2 days after eating the sandwich and died the next day. And his wife said to doctors, I think people who are diabetic or have an autoimmune disease or survived cancer should be able to eat in downtown Charlotte without the fear of dying. So we tell these stories to let the importance of our work sink in. And when we look at data and numbers and graphs of foodborne illness across the US or our state, it's really easy to forget that these are human lives lost and real people impacted. So when we ask what is the significance of food safety, this is why, right? This is why we take the time to really talk about the proper processes and ways we can prevent foodborne illness. So, Elisa, are there any questions in the chat that we can address before we take a quick break?
Yeah, there was one question in the chat here. Could there be a correlation with how much people eat out each year? Recession years, pandemic years, where there are fewer outbreaks?
That's a great question. And I believe, I know we have Mile on the call, and it looks like Joe came off mute as well. I believe we did make that observation in 2020 specifically when things were shut down and fewer outbreaks were reported. But you could also consider the impact that, let's say, the pandemic had on some of the healthcare systems as well. Joe or Mile, do either of you want to touch on that?
Yeah, I think it's too early to know for sure what the exact impacts were, but yeah, we don't think there were necessarily less outbreaks. I mean, it's certainly less people that eat out. We could have less. We also have outbreaks from home, of course, but really, this is just an opinion. We don't know yet. There'll be lots of studies, I'm sure, that will come out. But there was decreased lab capacity for testing. People were reporting different symptoms than they typically, would present, and maybe people were a little more sensitive to upper respiratory than lower GI symptoms. So between all those different factors, I don't think the numbers were too much different in those years. I just don't think we know about them. We didn't learn about them because of the various impacts that they had on as Chelsea said, on the healthcare system. That's my thought on that one.
Cool. Thank you, Joe. Are there any other questions, Lisa?
Yeah, so I think it was kind of answered in chat. I don't know if you want to touch on it, Joe. Can the incubation time be shorter for C. perfringens or B. cereus? Occasionally, we have people reporting lower GI symptoms much quicker than 8 to 10 hours that's listed.
Yeah, yes, those ranges that that Chelsea showed on those charts. There's lots of different charts of the different incubation periods, durations, symptoms, even of various pathogens. And so, with incubation period, it is definitely variable. Depends on a lot of different factors. As on the slide right now, it shows someone who was diabetic and had a more severe condition or more severe reaction to their infection than maybe someone who was not having diabetes or another autoimmune disease. So there could be shorter incubations because of those factors. It's also important, of course, during outbreak investigations, which most of you already know this, but when we take incubation periods, we have to be careful to assign the incubation period according to the food they actually ate. If that makes sense, because sometimes people report they got sick from food A. When we do investigations, sometimes we find, oh wait, it was actually the food you ate yesterday or 2 days ago, not what you ate this morning. But with Clostridium perfringens, there absolutely could be shorter incubation periods than what we have, especially if it's correlated to you put it all together, you find the contributing factors, you find the food of interest, and it points to a like an outbreak that would be typically caused, or that would be typically involve Clostridium perfringens, because it's not always, we don't get a lot of lab confirmed C. perfringens. I don't think. It just depends. So many times we're relying on people's symptoms and what they're reporting. So yes, you could have certainly less time than that.
Joe.
Uh-huh.
So I guess, so if we have a meal that we're really suspicious about because it's their only common meal, like 2 people, right? So we're like, that's the meal in question. But then the incubation is like 2 hours, they have diarrhea. Do we write, I mean, I don't want to just write that off. I mean, you know what I mean? I want to be able to, I don't want to say, well, sorry, that's too fast to get diarrhea. It couldn't have been that meal. Like that's my question. So
Yeah, I wouldn't write it off. Include it in the report. I mean, again, you're painting an entire picture. You're taking, okay, these people ate a certain meal. They had diarrhea after 2 hours, and we did an environmental assessment, and we showed, for example, room temperature storage or improper cooling. So now you have evidence. We would never take just the fact that the incubation period is a little bit shorter than what the charts say as dismissing an outbreak. We want to put the whole puzzle together with all the information that we have, and then make a decision based on everything. And yeah, we would never just want to rely on someone's shorter incubation period as a dismissal. Does that
Okay.
make sense, Amber?
Yep, thank you.
All right. Let's see. And there's some information in the chat if you want to know more about some of the outbreaks that Chelsea was talking about. Lars put something in there. And so there's more information in there. And then we did have a question about the slides materials, and I put it in the chat, but if you didn't see it, the materials for these will be emailed to you once we get through all the workshop sessions and get everything organized and able to be shared. So I think, Lisa, did we catch everything?
We did.
Okay.
Perfect. Okay, thank you, Joe and Lisa. So we are going to take a quick break. Let's take 10 minutes and come back at 10:45. And yeah.
Okay, see you.
Perfect. So let's transition now to talking about how we can prevent such illnesses by reviewing proper cooling methods. So cooling is a common practice. Most food establishments do some level of cooling. A lot of packaged food that we purchase from wholesalers is often cooked, cooled, or otherwise processed. That said, cooling is frequently done incorrectly. So we'll cover the 2 primary methods of cooling approved in Washington State here in just a few minutes. And cooling takes time. It takes practice and attention to do it correctly. We really encourage the use of policies and procedures, training programs, and active managers who are willing to monitor and correct cooling practices when they're done incorrectly. And as we discussed, cooling can be potentially dangerous, right? So if the attention and the time is not taken, it can lead to illness and often fatalities as well. So what is cooling? Cooling is taking food from hot to cold. So maybe the food was recently cooked and will be served cold, like cooking chicken breast to serve on a cold salad or to package and sell in a grocery store. Maybe the food was being hot held and cooled down after service to be reused the next day, like soup cooled before closing time. When food is cooled, it passes through what we call the temperature danger zone. So this is between 41 and 135 degrees. And the reason it's called the temperature danger zone is it's the range where pathogens are most likely to grow. So here you'll see the optimal growth temperatures for some of the primary pathogens that cause foodborne illness. You see our spore formers, our cooling pathogens, our B. cereus and C. perfringens. They rapidly grow between 86 and 116 degrees. And then Clostridium botulinum, the other spore former, that's not our cooling pathogen of concern, rapidly grows between 54 and 95. So remember, these spore formers cannot be killed from cooking. Of course, there are other factors that contribute to whether or not a pathogen will grow, such as pH, moisture, and oxygen. And then of the non-spore forming bacteria that we've talked about, they also have optimal growth temperatures within this range. So our Campylobacter jejuni grows between 86 and 114 degrees. That's a pretty wide range, right? Listeria between 86 and 98. And then we have our E. coli and our Salmonella at 98. So it's really important to keep foods out of the temperature danger zone whenever possible. And when cooling food, to move quickly through this temperature range to avoid pathogens from rapidly multiplying, especially those spore formers that we learned about earlier. So one of the leading causes of foodborne illness is the failure to properly cool food. When cooking food that is not served immediately, it's really important to get the food out of that temperature danger zone quickly. So here we're looking at the top 10 risk factors causing foodborne illness in Washington, and you'll see cooling ranks number 4. You notice those top 3 risk factors are employee and health and kind of person-focused contamination. So you have your ill workers, improper hand washing, bare hand contact. But cooling is the top risk that's related to an actual food process, right? Cooling was also identified as the #1 contributing factor in nearly 2,000 outbreaks of C. perfringens in the US between 1961 and 1982. So cooling is a process that's very important to be executed properly and using the correct methods. Okay, so let's talk about those methods. In our Washington State Retail Food Code, WAC 246-215, cooling is outlined in section 3515 and 3520. So one cooling method in Washington State is called shallow pan cooling, or the 2-inch method. So this is where food is cooled in shallow pans at 2-inch food depth or less, and when cooling meat by reducing its size up to 4-inch thick slices. This method is unique to Washington State, and it's a provision that's specific in our food code. The other method of cooling is the classic time temperature or 2-stage cooling, where food is cooled from 135 to 70 within the first 2 hours, and then all the way down to 41 or below within a total of 6 hours. And cooling using this method can use any size container, but it does require monitoring of both time and temperature. This method is outlined in the Federal Food Code and is used in most states as the primary cooling method. So let's take a closer look at each. The shallow pan or 2-inch method is where food is cooled uncovered with a food depth of no more than 2 inches. The cooling should be done in a refrigeration unit that is 41 degrees or less, and then the intact meat, like large roasts, should be reduced to 4-inch thick slices or less. So there's no temperature monitoring needed and no time requirement for the food to reach the cold holding levels of 41 when using the shallow pan method. It's also very easy to visually monitor because you can just quickly visually evaluate the depth of the food. So the reason this works, large food items such as roasts or turkeys, and also large containers of rice or refried beans, they take longer to cool because of the mass and volume from which the heat has to be removed, right? So by reducing the volume of the food in the individual container, that rate of cooling is dramatically increased and the opportunity for pathogen growth is minimized. So we're basically allowing for safe heat transfer just by reducing the size of the food. So in using the shallow pan method, again, the food has to be uncovered until the food reaches 41 or less. And we'll talk about ways to identify some physical parameters, such as looking for condensation or identifying deep dish cooling. And similarly with this method, it's very easy to evaluate the depth of food, right? So some of you in this room may recognize these hands as the legendary Janet Anderberg, and she used the depth, she used the width of her 3 fingers to evaluate the depth of food. So again, it's really easy to visually monitor and identify whether or not the cooling depth has exceeded those 2 inches. So the other method of cooling is called time temperature or 2-stage cooling. So this is where food is cooled from 135 to 70 within the first 2 hours, and then cooled to 41 or lower within a total of 6. So this is what we call the cooling curve. And those initial first 2 hours are really the most crucial time period, since the food is passing through the temperature range that supports the most rapid microorganism growth. So If it doesn't reach 70 within those first 2 hours, it either needs to be reheated and start the cooling curve again, or it needs to be discarded. And similarly, if the entire process takes longer than 6 hours, it also is at risk for being discarded. So it's really important to monitor time and temperature to track this curve and avoid having to discard products. That said, every batch of food has to be monitored since various foods have inconsistent volumes and dimensions. When your two-stage cooling is used, a lot of the time, operators will use rapid cooling methods that can assist in bringing the food safely down to 70 quickly to get through that stage 1, making it a lot easier to stay on track with the cooling curve, and may also allow more time to work through stage 2. So if you finish stage 1 in 1 hour, that allows you for more time to work through stage 2. So the process in its entirety can take no longer than 6 hours. It's just that first 2 hours is critical. So let's take a look at some of the rapid cooling methods that people can use to get through stage 1 quickly. And I'm seeing in the chat, Chris, you're correct. So the 2 inches is food depth, not pan depth. So we say shallow pan, but the 2-inch method means the food depth is 2 inches. Thank you for pointing that out. Okay, so here's some examples of rapid cooling methods. So these are often used to jumpstart that 2-stage cooling process to ensure the cooling curve is met, especially in stage 1. So getting food from 135 to 70 within those first 2 hours. So you may see some mechanical cooling equipment such as blast chillers or similar cooling chambers that are programmable and kind of just expedite that process. Also ice water baths, so placing food in containers in a bath of ice. Ice wands or ice paddles are also pretty common. They're frozen and then you can stick them in the food product. This is really common with liquid products like soups. Using ice as an ingredient is also an option. So just adding ice directly to the food can help cool it down. And then the use of certain containers can really help facilitate heat transfer. So for example, stainless steel pans will draw heat away from the food, whereas plastic containers will actually keep heat in. And then some other factors that affect cooling are food thickness. So the thicker or more dense the food, the slower it is to cool. Food size, your larger items are going to cool a lot slower than smaller items. And then stirring. So stirring of hot liquids really helps them cool a lot faster. And similarly, those ice paddles or ice wands can help expedite that process. So just looking at a comparison of the 2 methods, the shallow pan method does not require any monitoring. It's very easy to inspect and quickly evaluate food depth. It also encourages proper heat transfer to limit pathogen growth. However, it does take up a lot of space. So if you're cooling large amounts of soup, for example, and you can only fill your pans up to 2 inches deep, this could mean a number of pans filling the walk-in. The pans have to remain uncovered, so they may not be stackable. The facility may not have space in their walk-in for this amount of food, and this forces them to work in smaller batches. And then for our time temperature method, this allows for a lot deeper containers, which saves on space and allows for facilities to work with larger batches. But it does require monitoring of time and temperature and verification in every batch to ensure that cooling curve is reached. This can be very labor intensive. It may require special equipment. Okay, so let's now talk about how to evaluate cooling methods in an establishment. Since we have a kind of an array of attendees today, we're going to cover both ways inspectors can evaluate cooling and ways operators can ensure their cooling methods are properly being used in their establishment. So for the inspectors in the room, remember cooling is typically a very long process. And since our visits are typically just a few hours a couple times a year, we're really not likely to see cooling from start to finish during our visit. So some tools you can use to evaluate cooling. You want to start every inspection by reviewing the menu. This will give you an idea of what processes might be occurring in the establishment, including cooling. You also want to determine what foods are being cooled. So this can be through conversation, observation, or asking questions. And the operator should be able to describe to you when, where, and how foods are cooled. And with an understanding of what methods they're using, you'll have a direction of what to look for during your inspection. Remember that inspections are really educational opportunities and a time to build rapport with operators. This is not a time to kind of come down on them for what they've done wrong and then leave. You really want to take the time to explain to them why it's important and work with them for developing some methods that may be more realistic for them, right? What will work for you? Is it smaller batches? Is it using a different method? You really want to take the time to educate. Okay, so what to look for? You may quickly notice that they have cooling equipment in the facility. Maybe this is a blast chiller or other mechanical cooling equipment. Maybe they have ice wands or paddles or the classic shallow metal inset pans. These are great conversation starters about cooling, like, hey, I noticed you have this equipment. Talk to me about how it's used. You know, what are you cooling? How do you monitor cooling? Do you have anything cooling today that we could look at? Taking a look at their equipment is really a great indicator of what they're doing in their establishment, especially if cooling's not taking place while you're there. Also, do they have a hot hold line? So you may ask what happens to the food at the close of the service period, right? Do they discard it? Do they cool it? This is really a great conversation opener about their cooling processes as well. The hot hold line is also a good indicator of the potential complexity of their process, right? So the food may have been cooked, cooled, and reheated for hot holding. I mean, that's 2 full trips through the danger zone, right? So, or it may be as simple as they heat it up, they serve it, and they discard it at the end of the day. So observing the hot hold line is a really great time to ask questions about their food flows and their cooling and reheating methods. Remember that both cooling and reheating have the same pathogens of concern we've been looking at today. So both processes are very important. What's happening in the walk-in? So oftentimes the walk-in cooler is a good indicator of whether or not the establishment is cooling foods and what methods they're using. So remember that 2-inch cooling does not require temperature monitoring, but the food depth should be at 2 inches or less, and it needs to remain uncovered until it's fully cooled. So when you observe shallow pans with uncovered food, for example, the images on the right, it's an indicator they're using the shallow pan method. If you observe deep pans of food that is in the process of cooling, for example, the image on the left, you want to ask them how they're monitoring time and temperature, ask them about their process, you know, how long has this been in here? Are you tracking, you know, what's happening with this cooling curve? And remember, they have to monitor every batch of food. So if you do see deep pan cooling like this, you really want to start up a conversation about their method and how they're tracking and monitoring their cooling. So in the walk-in, it's not only an indicator of their methods and practices, but it's a great time to educate operators on the dangers of improper cooling. And then when evaluating cooling methods, it is really important to identify any signs of improper cooling and have a conversation about that. So some physical science characteristics such as condensation might be an indicator that the food was covered before it was fully cooled, trapping that heat in the container. Other things to look for, deep pans where time and temperature isn't monitored, maybe an indicator that they're using the incorrect method or they're kind of lacking in the monitoring realm. So just keep an eye on what you're seeing and keep having those conversations with operators. Make sure they're able to explain to you what they're doing and how they're doing it. Okay, so for the operators in the room, a strong way to evaluate internal cooling practices is by implementing what we call active managerial control, or AMC. So AMC is a preventative approach to food safety through a continuous system of what we call PTM, so policies, training, and monitoring. We love our acronyms here at DOH. So a little bit about PTM. Policies, they're a set of actions that minimize food safety risks. And although some small food establishments may have verbal policies, it's always best to write them down. And they should really include the key people of who will use them, the steps in your process, and the corrective actions. And we'll go over some cooling policy essentials in just a minute. Training of employees ensures that they're familiar with the policy and can demonstrate their knowledge by following the steps in each process. And the person in charge should have the monitoring and verification processes in place to ensure the risk factors are controlled and that processes are being followed, providing those corrective actions when problems do arise. So creating a cooling policy ensures employees know what to check, when to check it, and what to do if something isn't right. You really want to take time to develop a policy that works for you and then continue to update it as you put the policy to the test. So who uses the policy? Is there a certain person that's responsible for cooling? Maybe you have many employees and just a certain chef does most of the cooling. Maybe you only have just a few employees and everybody should be up to date on this policy. Also, what foods are being cooled. This will really help you identify what equipment or what methods might be necessary for your cooling practices, depending on, are you cooling mostly large roasts? Are you cooling mostly soups or liquid products? You want to really nail down what all foods you will be cooling in your establishment. And then when will food cooling happen? So is it going to be during operation? Is it going to be overnight? Is there a certain time of day that cooling could take place to ensure it reaches proper temperatures, right? If you are mainly cooling at night, then you're not going to have anybody there to be able to track that cooling curve. So maybe that's pushing you towards the shallow pan method rather than time and temperature. And then where will cooling happen? So you want to include all of your cold hold units, your refrigeration units, any ice bath or mechanical equipment, any areas where cooling is conducted, and that'll really help you piece yourself together so that everything is in one place. You have all the equipment you need, and it makes it easier for employees to follow your policies. And then the how. So how will food be cooled? You want to think about the realistic option for your establishment. If you're using 2-inch shallow pan cooling, do you have enough space? Do you have enough equipment? And if not, do you need to reduce the amount of product you cool? If you're using time temperature, do you have the logs and documentation to record that curve? Who will check it? I mean, this is where you really want to nail down how this is going to work out for you. And then finally, what are your corrective actions? So what happens if something goes wrong? Your policy really wants to state what actions are taken if those cooling parameters are not met, and what you're going to do about it. So for a cooling policy to be effective, you want to set your employees up for success. You can develop a training program. So by identifying who trains your employees, how training will be conducted and how often. And training doesn't have to take a lot of time. In fact, providing brief food safety trainings on a regular basis is really an effective way to educate your staff and keep them up on the policy, especially if it changes. And then during your trainings, you're trying to influence human behaviors, which can be very challenging, but you will be rewarded. And then having the right equipment for the job, so dedicating space for your equipment to be set up, making sure your employees have the right equipment to follow your procedures. If you're using shallow pan cooling, making sure you have plenty of 2-inch pans, or they can be deeper than 2 inches, but plenty of pans that are available and plenty of room in the walk-in coolers for that cooling to take place. And then similarly, if you're using time temperature, making sure employees are set up with thermometers, monitoring logs, and have been thoroughly trained on how to use them. And then lastly, employees should really know who to go to if they have questions. So there should always be a person in charge on site during operation who kind of oversees the employees, make sure they're following procedures, and then employees feel comfortable going to them if they have any questions. Okay, so monitoring, verification, and corrective actions. When you're developing your cooling policies, you should have an idea of what you're going to do to monitor, verify, and correct before putting this policy into place. So for monitoring, this is when the person in charge is overseeing the process and making sure that procedures are being followed by food workers. So when monitoring cooling, the person in charge can monitor the depth of food, if they're using the shallow pan method, also ensuring that equipment is available. And if the establishment is using a two-stage cooling, you can monitor by reviewing logs, making sure that cooling curve is met. And then for verification, that's basically ensuring that the policies in place are working. So if your monitoring indicates there's a flaw in your cooling practices, you want to ask, does my policy need to be updated? Does my staff need more training? What can we do to get this back on track? And then for corrective actions, these should be predetermined in your policies. So this is what you would do if cooling is not done correctly. Can the cooling curve be corrected? Can the food be reconditioned by reheating it or cooking it to start the cooling curve over? Or does this food need to be discarded? So you want to have these corrective actions in place, and really you want to have everything set up for yourself before you put your policy to the test, right? So I hope everyone feels strongly that properly cooling food is important. People get sick, hospitalized, and even die every year because at some point a food they consumed was improperly cooled. And we talked about our spore-forming bacteria such as Clostridium perfringens and Bacillus cereus as the cooling pathogens of concern. We reviewed the two methods of proper cooling. So we have our shallow pan, which is specific to Washington State. It's simple to achieve, easy to evaluate, and doesn't require any monitoring. And then we have our two-stage cooling, which is our other cooling option. And this method does require monitoring of every batch to ensure that cooling curve is met. And then we talked a lot about evaluating cooling, so inspectors knowing what questions to ask about methods, looking for physical signs that food may be cooled or improperly cooled. But most importantly, inspectors are there to educate operators about the importance of cooling and about the importance of their practices. And then for operators, we talked about implementing PPMs, that's policies, training, and monitoring efforts, and having the corrective actions in place so that if something does go wrong or the policy isn't followed, that they can find a way to rebound from that and correct it. And then just remember your work is important. We are truly saving lives by keeping food safe to eat. So keep fighting the good fight. And I hope everybody's excited to kind of go back to the drawing board and is inspired to make some changes after today. So we will take questions. I'm assuming we have quite a few.
We have some great comments in the chat. I know Joe wanted to touch on a couple things.
Yeah, while you're looking through those, Elisa, if you want, one thing, let's see. Well, one thing we talked about, let's try, there's a lot of chats. I'm trying to go in the order that we want to discuss them in. Let's talk about with time temperature cooling. So in our experience in Washington State, as Chelsea described, we have the 2-inch cooling method. We've had it for many years, and most operators tend to use that because it's simpler. But when using time temperature cooling, Chelsea touched on the monitoring requirements, and she also gave best practices for verification and documenting. The code doesn't require monitoring, documenting, and verifying completely, but if you're really trying to figure out, am I meeting the time temperature parameters, then that's going to be the best way. There's also discussion about data loggers. Those are a fantastic way to make sure that you're meeting the time temperature parameters. But with time temperature cooling, if you're going to be using a method, you come up with your own method. You know, we have a certain special, maybe some kind of soup that we have every Friday, and we cool it the same way every time. And we've verified and validated that the process we use is consistent and it works. Maybe it's a blast chiller. Maybe it's you start it off in the freezer for an hour and then put it in the refrigerator. I've seen different ways that people do time temperature cooling. So if you have a validated way that's consistent, then every batch monitoring probably isn't needed. But if you are going to do leftover foods and do that all the time and a random amount of food every single time, you're not using the 2-inch method, then you would have to have much more stringent monitoring requirements for varying depths and amounts of food. It's just naturally you're not going to be able to have a validated process when it changes like that. And if you do have a validated process and keep varying from it, then you're going to have to go back to monitoring as well. This is really why we like the 2-inch method. It requires a little less work on your end. Of course, it takes a lot of space, which is another issue as well. So Elisa, what else did we have? I think we had something about stacking I think I didn't, that's the exact question. Do you have the exact question from you, Lisa, about stacking?
I do. It just says to please address pan spacing on cooling racks.
Chelsea, any thoughts on that? You want me to take it?
Yeah, so I mean, I don't think that there's anything explicitly preventing pans to be stacked on cooling racks. The food itself has to remain uncovered. And really that is to encourage that heat transfer of the food. So it's tightly stacked on, I'm thinking of a speed rack, say in a walk-in, that can be okay as long as the food itself is not covered. Joe?
Well, covered, and the other problem we have with speed racks is now you have, instead of a 2-inch depth of food, you have a 12-inch depth of food because they're all stacked on top of one another in the speed rack. So they're naturally, just with physics, there's going to have to be some circulation that's in there as part of that, because we're looking for a 2-inch depth of food uncovered, not a 12 to 18 to 2 feet to 3 feet depth of food. And once you start stacking those and putting those in speed racks, one on top of the other, you're going to have a different depth of food. Plus, again, as Chelsea said, they're more covered than uncovered at that point. So there's going to have to be some spacing between the pans on a speed rack to make sure that there's air circulation and that we have not gone over the 2-inch depth of food.
There's also some good conversation going on in the chat regarding cooling or chilling of large quantities of cut leafy greens, shredded cheese. That's commonly overlooked during inspections. And they clarified thinking of like large garbage can size. So there's some great conversation going on with that. And one of the questions,
cooling from ambient, I think is what people are getting at, what I've seen. So it's when people are preparing sandwiches, sushi rolls are a good example. Cut leafy greens is stated in here. Those need to be prepped, and then often they'll be cooled, and that's cooling from ambient temperature. That's not cooling, from above 135. So that needs to be, it is cooling. It's an example of cooling. It needs to be evaluated and practiced just like other methods of cooling as well. Well, and there's also a discussion, I think, about plan review a little bit. I saw some chatter about plan review, the importance of making sure capacity is a big issue with cooling. I saw Jennifer Jessen was concerned about sometimes facilities just don't have enough refrigeration, even though it's approved in a plan. And so Tom Kunish mentioned, he's from Whatcom County, he mentioned that they have a caveat in their plan review that refrigeration will be monitored. They'll, of course, evaluate it during the plan review, but refrigeration will also be checked during inspections. And if it's proven to be not of enough capacity, then they could require more refrigeration. It's really, obviously we ask all the questions in plan review, or we should be asking all the questions about what foods do you prepare in advance, what's your style of preparation, and learning all those things help us determine. And there are even mathematical equations that we use for determining capacity. But even with those, sometimes plans change, people's menus change, and so different things happen. And so there needs to be some plans, both on the industry side and the regulatory side, on how to adjust when there's just not enough space. I think someone mentioned in the chat too, I didn't see who, about trying to stagger when you do all your cooling, instead of doing all your cooling at once, try to space it out. And so that's a good comment as well.
There's another comment in here that they state, it also makes a difference where they are in the cooler. By the doors, the warmest area of the walk-in. Is the speed rack in front of the fans?
Say that again. I'm sorry, I missed that.
It makes a difference where foods are placed in the cooler. By the doors, the warmest area of the walk-in. Is the speed rack in front of the fans?
Okay. Yep. But again, it's all 2-inch cooling. I mean, we can give them recommendations about where to put it, but 2-inch cooling is 2-inch cooling. So as long as it's in a 2-inch layer of food, that is allowed. But yes, there are certainly tips we can give about how to get things colder using the science that we know.
Here's another question. Can we comment on potential contamination prevention with open containers of food stacked in the walk-in?
Can we comment on it? Yes. So there's other ways to prevent contamination besides just covering. I mean, where you store the food in the walk-in or the reach-in, wherever it is. So yeah, there needs to be a plan on how you're going to prevent contamination of the food. But I would say that just an open pan of food in a refrigerator doesn't mean it's being contaminated, or there's even a potential. You have to evaluate that as both the operator and as a regulator. Evaluate, hey, this is where we're going to cool our food. We're using the 2-inch method. We're going to have it uncovered. Is this a safe space for us to have that food? That has to be analyzed both on the industry side and the regulator side to make sure that's the case. But just, we've had questions about that before. Like, well, wait a second, the food is open. Well, again, the question really is what is going to potentially contaminate that food? If the answer is, well, nothing, then it's fine. If there's something that could contaminate the food, then it's going to need to be moved somewhere else and cooled in a different location. I think that's what he's getting at.
Is freezing an appropriate kill step for the spore-forming bacteria? Can the spores survive freezing?
All right, I'm going to try my micro knowledge, and then Susan can fill in the blanks if she needs for someone else. But I think technically, I think that the spores could survive freezing. However, the freezing as a way to cool food rapidly, what it does is it gets it down to that danger zone rapidly, and so you prevent too much. You prevent the bacterial growth. Those spores will sporulate at the ideal temperatures that Chelsea showed you in that chart. And the faster that you go through that danger zone, the less they have, the less they will actually, the spores will actually open up and let out the vegetative cells. So freezing, while it may not kill the spores, there is less time in the danger zone, which is going to decrease the amount of vegetative cells in that food. And also less time for growth of that food. So the more rapidly you cool, the better. And freezing or cooling in a freezer is a great way to rapidly cool food. I have seen techniques where people will start food out in a freezer. They don't want to freeze it, but they want to get it started rapidly. Now, the problem with that is sometimes they forget about the food and it does freeze. So you got to keep that in mind. Yeah, so Susan has given a good description that spores are the cockroaches of the bacterial world. But again, that key is rapid cooling. That's what we're really striving for, is minimizing the amount of time in the danger zone. And that's going to be your best bet.
We have a comment in here. It says, can we please comment on how long a TCS food can be in prep before becoming concerned with pathogen growth?
I think we have more of a concern about temperature than we would time. I mean, it just depends. I mean, that's a pretty open question. And it's going to depend on the specific food. There are a lot of factors there. We ask for, and our code we require active preparation. So food shouldn't be sitting out, let's be active prepared, but you can prepare a lot of food. I guess you can debate what active preparation is, but we're much more concerned about the temperature than the time. And Chelsea showed you those she didn't show you growth curves, but she showed you the ideal temperatures where the bacteria thrives. And that's what we're trying to avoid. So I think that's kind of a case by case as far as the process, but we certainly wouldn't want people to be actively prepping one large batch of food or a whole bunch of food at once. We want them to be able to rotate that through, but I don't think I have an answer about specifically the time. It's much more going to depend on the temperature. If it's a hot kitchen, then you're going to want to do that faster and with less food and rotate it through the kitchen, the refrigerator faster. If it's not, but I don't know if I have a specific, there's not a specific, I don't think time temperature is going to depend on the pathogen load of the food, the type of pathogen, lots of different things. But I know that if you minimize, that's also a loose word, the time that it's being prepped, you prep things as fast as possible, it's going to be safer in general. Does that help? Do you think that's a good one, Susan? Good enough? All right, so Phoebe wants to go back to ambient air cooling. Is that what I see, Elisa?
Yes. Is it a 25-point violation, though if it is 70 degrees or colder, wouldn't it be a lower cooling concern? Has there been discussion of making a non-critical violation like cold holding and hot holding?
And Tom, do you want to comment on that specifically or something different?
Something different.
All right, so we'll leave your hand up there for a moment then. And I'm going to scroll back up and see this question here. I don't know if we've had a discussion on making ambient cooling a different violation. I have to look at the marking instructions for sure to make sure I even know where precisely it is, but it sounds like it's in the same spot. Cooling is cooling is cooling, it sounds like, from what I have to see who that person was.
You are correct,
Phoebe.
though, Joe. Cooling
Phoebe.
is cooling is cooling.
Okay.
On the
So-
in our marking instructions.
So there hasn't been a discussion yet. I mean, it sounds like someone maybe want to have a discussion about it, but we have not discussed it yet. All right. Tom?
Yeah, I just want to make a couple of sort of generic points about cooling. I think it's what we've experienced here is sort of we get into a quandary a little bit. We have a technical cooling violation, and from our enforcement policies, cooling violations are 25 points, and that's a lot. It gets a person a long way toward enforcement action and reinspection fees and that sort of thing. So what we've done is we've kind of drawn some parameters around what about cooling will cite the violation, but it may not count toward enforcement unless it meets certain criteria. I think it's important for us in our minds to triage high priority versus lower priority cooling issues. For instance, cooling stuff below 70 degrees is a much lower risk than cooling stuff through that temperature danger zone. A technical violation of food that's 3 inches deep versus food that's 13 inches deep is a night and day difference in terms of risk. And also go and look up some old outbreak scenarios and studies. And I think what you'll find is when overall cooling takes more than 12 hours, then we start to get into risky territory in terms of growing enough of our spore-forming pathogens to make people sick. When we're in the less than 12-hour zone, yeah, that's still a violation and it's still a practice that we need to address and educate and correct, but it's a much less risky thing. And I just encourage inspectors to keep that in mind when they're out in the field working with our operators.
Thanks, Tom. We do keep these chats, so you know, so we can also look through these questions. We obviously heard a couple comments or thoughts about marking instructions and points and where to put things.
Yeah. And there was another question in there. It says, no loose parchment paper over cooling pan when space contamination is a concern.
Let's see, what time was that? The other time?
Was up a little bit, 11:21.
There we go. What have we said in the past, Susan, about loose parchment paper? I'm pretty sure covered is covered. And if there's a concern about contamination, and it depends on what contamination you're talking about, but most of the contamination that we care about, which would be cross-contamination from raw meat, that parchment paper isn't going to be a huge help. And that's my opinion anyway. So I would just say that you need to find a spot that's not going to have a potential contaminant. Susan?
Yeah, so our code specifically says uncovered. So for us, that's any kind of layer on it, whether it's light. I know the federal model food code says partially or something like those, but our code is very clear. If you're using the 2-inch method, it has to be uncovered regardless of how light that cover is. And similar to what Joe's saying, most of the contamination would probably be through, not through overhead dripping, but through air movement. If anything's in the fan system, or, you know, if you're worried about listeria or something along those lines, the parchment would not really protect from contamination in that respect. We're relying on both convection, so air movement, but that also evaporative cooling when we're talking about food. So we expect zero cover. Realize that's a corporate concept as well. And a lot of states actually do require food to be covered in the refrigerator. The code, even the federal model food code, doesn't actually require it until it is actually 41 degrees or colder to be covered, that is.
And then to me, I think if someone has a situation where they feel it's important for them to be able to cool the pan, then that's going to be into the time temperature cooling. And now you're going to have to just make sure that whatever your method is actually meeting the time temperature parameters of the code, because it wouldn't, I guess, it wouldn't qualify to be considered 2-inch cooling. That goes into the time temperature cooling part of the code. Elisa, anything else?
I'm not seeing any more questions.
Chelsea, you want to wrap it up? It's 11:28.
Yes. Thank you, everyone. This was fun. I hope everyone else had fun. We have another session this afternoon for those of you who are registered. And so I hope you have a great lunch hour and a great afternoon, and we'll see you all again soon.